Rochas, Okorocha, Imo West. Mr. President, distinguished colleagues, this motion before us by Senator Tinubu is very, very popular, as identified by the number of co-sponsors. Mr. President, the essence of government, or any good government, is simply to save the lives of the numerous poor masses while protecting the interests of the few rich. But this doesn't seem to be the case in our country, as we have very poor masses and citizens of this country who are languishing in our rural areas for lack of adequate medical care. While we're here, and I believe from the contributions so far since the inception of this Senate, it's a pointer to the fact that we're here to save the lives of these numerous poor masses. And when we're talking about primary health care, most people tend not to understand the importance of this primary health care from the other side, which is meant for the people in the rural areas, those who could hardly afford medical care. Mr. President, I'm sure you are aware, and most of my colleagues are aware, that many Nigerians today cannot afford 5,000 naira for hospital bills. And so the urgency now to fund these centers has become imperative. And we should go a step further, because the social infrastructures are the pivot upon which the wheels of every successful government must rotate, and that is education and health. It should not be made to just be affordable, and it should also be made free, because our constitutional provision requires government to protect lives. So this also takes us to the constitutional part of our argument. While I support, and I'm proud to be a co-sponsor in this, we shall take further steps to ensure that this is just not a theoretical fabrication, but to reflect a practical realities. This very subject matter requires partnership between the executive and the legislature in ensuring compliance and execution. It is for that reason that while those prayers and requests she has made, I will request that within that agency, a department be created for the purposes of monitoring and ensuring quality delivery in this department. And there seem to be so many programs revolving around the same issue. This Empower project and this Poverty Alleviation program, and we should find a way of consolidating them and probably making a bill that will be more lasting to bring them together. Because we tend to be duplicating different things from different angles, and it's not making any impact. So I agree with Senator Nnamani from some of his provisions he has made. But we must find a way to tie it also to those basic infrastructures of education and health. Thank you.